नमस्कार. प्रुडेंट मिडियाच्या गजाली ह्या कार्यावळीन आज आमचे बरोबर आसात एक नामनेचे ऑन्कोसर्जन, ऑर्थोपेडिक ऑन्कोसर्जन डॉक्टर प्रमोद चिंदर, जे HCG हॉस्पिटल बेंगलोर हांगा काम करतात आणि तांचे खाशेलेपण आसा की हाडाचे जे कर्करोग असतात म्हणजे कॅन्सर असता ताचे विशीं तांच्यांनी सुपर स्पेशलायझेशन केलां आणि ताच्या विशीं आमी आज तांचे कडल्यान म्हायती करून घेवया. Doctor, welcome. Namaskar.
Namaste, namaste.
Basically, you are in a very super specialized field, that is oncology associated with orthopedics, which is perhaps one of the rare entities. Very few people, maybe in India, we have at such who have chosen this path. I should say a path less chosen or less taken. First of all, it will be very nice of you if you can tell us what you mean by cancer of the bones, because it is not so common like we have other cancers of the other body parts. What do you mean by that? How will you define this?
See, bone cancer is very, as you rightly put it, it is very, very rare, and I am also a rare species in the whole country because it is we are around 7 or 8 of us who do deal these things.
Correct. In entire country.
In entire country.
Yeah. So I should consider myself fortunate. I am sitting with one of the
I am more
entities.
fortunate to enter into Goa every time. Yeah, Goa makes me. So bone cancer is mainly seen in children. That very rare because see, if you see 100 cancers, bone cancers are seen in 1 in 100.
I see.
Yeah, that means we are such a rare species. Yeah. So and bone cancers are seen in children, and in my Indian experience, whatever it is seen, it is seen in the underprivileged or probably a lower middle class or a middle class families. It's more, and hence what happens is it is either one thing, it is neglected. And number two, probably we see it in a later stage where we cannot
do anything
much about it.
So you mean to say incidence is quite rare. And what is the age group which is usually affected in this type of cancers?
Usually from say 6 to 15, growing period basically, when the child grows. So that is when the bone increases in length. So जब bone grow होता है, that time some cells will lose the cycle. Cycle lose हो जाता है. So then what will happen is it will become cancerous.
अच्छा.
So that is how during the growth period it is seen. That's all. जब grow कब होता है 6 years to say around 15 16 years में, वही common है.
Yeah. So basically you mean to say that these are the cells which are usually in a phase of multiplication, but they multiply at a faster speed and faster rate, and it becomes uncontrolled.
Correct. Yes, sir. Perfect.
If I put it rightly. Yeah. So doctor, you just tell me what is after this, like what are the signs and symptoms? How you will know like this particular baby is having the cancer? I mean, or it is heading towards the cancer.
Correct. Very important. This is, I will tell you, this is very important because see, what generally most of these children will have a important thing is pain. Pain means we think pain is a very तो चल जाएगा ये गिर चुका होगा, साइकिल खेलते हुए गिर चुका होगा. और what will happen is we first initially start treating with regular analgesics, or probably will neglect only. Yeah, after 1 week they will go to a regular doctor. Regular doctor will give analgesics. So pain नहीं come, it will not come. Then they go to a pediatrician. Pediatrician put him on antibiotics. सब होता है. So इस time में almost 1.5 months चला जाता है. So this pain में I want to reiterate, ये कैसे identify करना? Pain which wakes you up from the sleep. बोला तो ये बच्चा नींद से जागता है. Exactly. Means suddenly it will be sleeping at around 12 o'clock or 1 o'clock. Suddenly gets up because it says pain. No, I can't. It's very. This pain will not happen if the child has had an injury or even an infection. This pain will not happen like that. This is mainly a cancer related pain.
I see.
So this is one of the very early detection signs. If any of the doctors or if any of even the parents come across such this one, that is the point we should catch it.
I see.
Because point at this appearance to the point they come to me or a super specialist, there is a big gap, say around 6 months.
Correct.
For 4 to 6 months, that is a very important period. Which can curable to becomes a non-curable.
I see. So, doctor, which are the sites usually? Like, see, you told me like a characteristic of this pain is that a person or a child wakes up in the midnight or maybe from the sleep. And what are the which are usually sites? कहाँ ज़्यादा दर्द होता है?
Mainly in the knee joint. Number one commonest is knee joint. Next is the shoulder joint. Then very rarely elbow and the hip joint.
So this is mostly at the joint side.
Exactly, around the knee, around the joint, because that is where we grow. as you doctor we have studied
Yeah.
during MBBS. In the knee, we grow at the knee.
Yeah.
We grow in upper limb, we grow at the shoulder and the wrist. हमारा height उधर ही बढ़ता है. So that is the most active area. So that is the most commonly seen.
अच्छा. So once a child comes or the parents get a child with such complaints to the treating doctor, let's start from the basic, like what should be our approach, like okay, from where, because now you have made a very important point, even the doctors have to be more alert, and this should be taken as an alarming signal.
Absolutely.
Because often what we end up is saying, okay, calcium deficiency, बच्चा कहाँ गिर गया होगा, maybe that he has got some injury. It means common, our common approach. It is not, but now to think out of box, or maybe like something is coming, it is alarming signal. What should be our approach? Like?
Yeah. So important thing is a pain which is not coming down by regular analgesics.
Yeah.
One, night pain. Number two, sometimes this pain associated with say low grade fever and unable to eat, loss of appetite, or probably an early weight loss. Okay, these are few things which are associated. Immediately you should catch. These are some, like we call it red flag signs.
Yeah.
Once they are there, either you investigate by yourself, the best is an X-ray. I would rather tell now an MRI, because earlier MRI was not so easily available. Now it is very easily available and it is not very expensive. We can get a basic MRI without contrast, plain MRI. Best screen it off, finish, and it is not radioactive.
Correct. No radiation.
No radiation. Child ko bhi bilkul safe hai.
Correct. So, doctor, at this point of time, I want to ask one more thing. Like as you said that you take one basic X-ray. X-ray, does it show anything which will make you feel that yes, I have to go for MRI? I mean, for the doctor, I'm just asking, or the patient.
Correct.
Then what is that?
So, X-ray generally, it is by the time X-ray, by the time you see in the X-ray, it is around 2 months, 2 to 3.5 months since you started.
Oh, I see.
Best is MRI.
Acha.
MRI is the best to detect early.
So MRI gives you a almost clear picture that
very clear picture.
This phenomenon is already
best
occurring.
It is.
Any other tumor markers, because now we have got a lot of cancerous growth are detected in the phase or maybe little early also, I can say. Anything like what you do in the blood investigation or anything in this?
No sir.
Nothing.
MRI I would suggest MRI would be the best.
Acha. Any other investigation to establish and certify your diagnosis?
Yeah. After we do the MRI, we do a biopsy. Biopsy that is also what I want to reiterate here. Biopsy cannot be done in any place as you want. Biopsy should be done because here we are aiming at a cure of a patient. बोला तो complete cure करने का इरादा. So every single cell is important for me.
I see.
So biopsy, छोटा biopsy इधर ही करा के जाते हैं. नहीं. Biopsy, though it is very small, it has to be planned well. क्योंकि we have to remove the biopsy track. जब भी needle जाता है ना अंदर, वो needle का track भी निकालना है जब वो tumor निकालते हैं.
Oh, I see.
क्योंकि उसमें seedling होता है.
I see. So how you remove that track?
If we mark it, we know where we do the biopsy. When we go for a proper surgery, we mark it, we go around it. We don't go inside it.
Acha.
We go around it like a block and we excavate it like an RDX bomb. Something like that. En-mass toto resection.
Correct.
That is very important.
Acha. So basically, this is also very important thing even for the treating doctor as well as the family members, because often we have a feeling, okay, as you said, that we'll do the biopsy, confirm the diagnosis, and then we'll go ahead.
No.
So that should not be done. This is also one of the.
Please, that is one message I want to tell is, don't get the biopsy immediately done. The biopsy is the last thing in the investigation. First is MRI, but biopsy has to be done by the treating surgeon who treats till the final.
I see.
Yeah. Most of the doctors or anybody would be like, of course, we may lose a patient if we send it to somebody. That is a general feeling. But what I would say in these cases, situations, these are all very rare, one thing. We would see, or as general doctor would see 1 or 2 cases per year.
Correct.
So in these cases, it is always better to be in the team and work towards the cure of a patient.
Absolutely. Rather than
thinking that you are losing a patient. No, be with him.
Correct.
We get involved. That is what I always do with my friends, my friend doctors. If they say, I'm going to send it across, you take care. No, you are with them.
Absolutely.
I'm going to update you. You are coming during the surgery. So it is always better to be as a team as we.
And doctor, one more thing I just want to know. Now you have already established the diagnosis. Like as you said, you have done MRI. you've done biopsy, and your diagnosis is confirmed.
Yeah.
Then how you go about it, and then what are your stages in
Yeah.
different types of, I mean, let's come to the management part.
Correct.
Maybe in broader, you can take your own time and tell us
Right.
about it.
मैनेजमेंट सी वंस यू डायग्नोज अ बायोप्सी विद बोन कैंसर,
Yeah.
ओके, बोन कैंसर में सिर्फ 2 टाइप का होता है कॉमनली, जस्ट फॉर मेडिकल नॉलेज, ईविंग सार्कोमा, ऑस्टियोसार्कोमा, इम्पॉर्टेंट है, दीज आर 2. सो डायग्नोसिस के बाद हम थोड़ा पूरा सिस्टम को स्कैन करना पड़ेगा, क्योंकि वी शुड सी वेदर इट इज देयर स्प्रेड एनीवेयर एल्स इन द बॉडी,
I see.
लोकलाइज्ड और स्प्रेड, 2 इम्पॉर्टेंट थिंग्स.
Yeah.
लोकलाइज्ड है तो डेफिनेटली क्योर रेट्स इज एज गुड एज 70 to 80%.
I see.
बोला तो दे विल लिव लाइक यू एंड मी विदाउट फॉर लाइफ इफ ट्रीटेड प्रॉपरली. दैट इज 70 to 80% लोकलाइज्ड है तो.
Yeah.
थोड़ा स्प्रेड हो गया है तो कैसे कितना स्प्रेड है तो उस पर डिपेंड होता है. बट द बेस्ट इज once diagnosis is established, we generally discuss as a team, around 8 to 10 doctors, pathologist, radiologist, pediatric oncologist, psycho-oncologist. ये सब मिलके we call it a tumor board. Tumor board. Tumor board में डिस्कस करके प्लान लिख लेते हैं. जनरली इसको कीमोथेरेपी देना पड़ता है. You have to give a chemotherapy. Means either to decrease the size or decrease the disease load for operation. Then size decrease करने के बाद operation करते हैं. This chemotherapy को we tell it as neoadjuvant chemotherapy. Okay. Essentially this whole treatment it involves chemotherapy, that is medical oncology, surgery, that is orthopedic oncology, radiation sometimes. Radiation oncology. So essentially whole the gamut of doctors are necessary.
Correct. Yeah. So it is, as you said, it is a full team is involved, and it is a work of not one individual but as a full team.
Never.
At every stage, you have the team members playing their role, and
including nurses, including the family, including the school, including the children. Everybody should be involved. There are a lot of parents who come to us and tell, please don't tell my child that he has got. I said, no, I think you should be honest to the child. Because honesty, because once you tell what is right, he will believe you. Somehow these days it's very easy for children to write a Google. Google में देख लिया वो क्या है, discharge summary में क्या है मुझे देख लिया, हो गया, he will know. It takes a fraction of a second for the child to know.
Correct.
So you should get the child into confidence. Tell him what is right, because it is not a small treatment.
Correct.
So it's for a year approximately. Bone cancer treatment is for a year.
Yeah.
Proper treatment.
Yeah. So how many cycles chemotherapy and this radiation takes place around? Depends
on the disease.
Acha.
Yeah. Mostly it is usually 6 cycles to 14 cycles. 6 in osteosarcoma, around 14 cycles in Ewing sarcoma. Yeah.
And what is the role of radiation in this?
Yeah.
It is going in par with along with this, or
no.
This or that?
Radiation is an adjuvant in the sense.
I see.
Yeah, certain cases of Ewing osteosarcoma, generally there is no role of radiotherapy. Wherein in individualized, personalized medicine we sometimes do give, but most commonly seen use in Ewing sarcoma. Sometimes very inoperable cases where you are going to do more damage by operating. One, in such cases. Number 2, sometimes even after giving chemotherapy, it would not respond. So sometimes we add it during that time. As a solo treatment, no.
Acha. So it works along with this.
Along with that. Yes.
And doctor, in your observation or since number of cases you must handle, what is your conclusion, like such type of cases, how they do, means how they do well, how long it takes for them to get settled, and usually what is the prognosis in general? Yeah,
correct. See, mine is not a very huge experience. I would say 6 years or 8 years, I would say.
Correct.
Since I started this orthopedic oncology. 8 years mein what I have seen is essentially worldwide. I have been trained in India, outside India.
I see.
In Gazali, Italy, which is the largest cancer, bone cancer in the world. Treating center, Gazali in Italy.
I see.
So we have a tie-up with them. HCG has got a tie-up with them. So means we have to develop a proper way of treating.